Anxiety attacks are one of the most common struggles I see students experiencing. When you're having an anxiety attack, you know it. You basically have a lot of physical symptoms, including uncontrollable crying. It can also include really, really fast heart rate, sometimes feeling like you're going to pass out. It could be uncontrollable shaking. Your hands could be sweaty or clammy. It could be that your stomach is upset. Sometimes students describe that they feel like the walls are caving in, or they might feel nauseous or like they're going to pass out. So it could be some of those symptoms. You don't have to have all of them, but really it boils down to uncontrollable thought process, irrational thinking, and feeling like something bad is going to happen, like an impending feeling of doom. And if you don't get out of where you are right now, that something bad is going to happen. So when someone's struggling with an anxiety attack, oftentimes what we want them to do is go to a quiet space or a quiet place, whether you're at school or at home. I'll first talk about what to do if you're at school. So definitely let the teacher know that you need to go to the counseling center. If it's not possible to let that teacher know, just come down to our office and we'll take care of notifying that teacher. You can come into the counseling center, or you can also go to the health office. Once a student comes into my office, what we do is we shut the door. I get the student something to drink, like a bottle of water, and then we immediately go into deep breathing. So I'm going to do a little bit of those techniques right with you today so that you can do these things at home too. So let's just do some inhalation and exhalation. I simply only want you to listen to my voice and follow along. So you might want to find something to stare at or an object. Sometimes students feel more comfortable closing their eyes. Other times they like to have their eyes open but fixated on an object. So sit back into your space, find something to stare at, and just listen to my voice. Let's start by taking a nice deep breath. Inhale through your nose. Exhale through your mouth. Inhale through your nose. And exhale through your mouth. Let's do one more. Inhale through your nose. And exhale through your mouth. So typically with your deep breathing, you want to inhale for the count of 3 and exhale for the count of 6. So what that does is when you regain control over your breath, your heart rate lowers, your thoughts are more clear, and you can focus on what we're doing in the office space rather than focusing on the anxiety. So once your heart rate is lower, you can think more clearly and more rationally. So you're lowering your blood pressure, getting control over that breath so that you can think more clearly. So once a student comes down from the anxiety attack, they have something to drink, we do some of the deep breathing exercise. Most times students like to fidget with something. So in my office, I have a lot of different options for fidget toys. Here's just a couple of the different fidgets I have. This is like a little bit of like a lava lamp. I also have this meshy marble, I don't know, it's like a fidget that you can just run your fingers along. There's some clay. You can mold different shapes and pull it apart. This is one of my favorites. This is a slap bracelet, that sequence. So really just anything that helps you fidget. What fidgets toys do is they help you become mindful. So you're focusing on the texture of the clay. You're focusing on the way that the colors look as they go up and down on this different fidget toy. So when you focus onto an object, it helps what I would call to ground you and to center you, to not thinking about the worry or the anxiety or what triggered that anxiety attack. You're really just focusing on the item that's in your hand. So when students come and their anxiety rates lower when they're doing some fidgets, then we can lead into that conversation knowing that maybe they're not as elevated as they were. There might be something that did trigger that anxiety attack. Sometimes there's no reason that anxiety attack happened. It just did. So students will then discuss about what's going on. Acknowledging that you had that anxiety attack is going to be huge, but also thinking about were there any stressors or triggers, and talking about that and getting that kind of out of your mind and off your chest can really help you to explore, maybe you are under a lot of stress and something did happen. We might be able to change or modify what's going on in your personal life to help you feel better about entering back into class or going on with your day. Anxiety attacks typically last, I would say on average, anywhere for a couple minutes to maybe 5 or 10 minutes. That would be a long one. Typically, when students do deep breathing, get something to drink, distract themselves with a fidget toy, and ground themselves, they feel much better. So you might want to scale, like, what number were you on a scale of 1 to 10 when you came into my office? What number would you rate that anxiety attack, 10 being the worst? Maybe you started off at like a 9 or 10. By the time you do your deep breathing, hydrate a little bit, do the fidget toys, typically what I find is students' stress level will come down to a level 4, 3, or 2. So just taking that break out, don't try to go throughout the day trying to deal with that anxiety. It just can mount and become worse. I would really encourage you to come and take a break, even if you don't want to talk, just taking a break in the library or going to the nurse or sitting in the counseling center. Even if you don't want to come into the office, that's okay. We can do and modify and adapt to whatever it is that you need. But, also recognize the fact that anxiety is really common among teenagers. 1 in 4 kids will have anxiety. So anxiety attacks aren't too uncommon. Typically every day, the counselors, psychologists, and myself all see anywhere from 1 to 2 to 3 students a day who are having an active anxiety attack. But know that they do reduce, and they can come down just by using the appropriate skills to what helps you feel better. But also you want to think about, whether or not you want to tell some family or friends, just to let them know that you had, an anxiety attack, so that they can help support you when you do go on to the next part of your day. We can call the teachers and let them know, and just to reassure them that if you need a break, that it's okay to let you come down. So teachers are really great about that and very confidential and respectful, and they want to help support you. I hope that helped.